With androgen receptor targeted therapy, it's really changed the whole landscape of prostate cancer, because now we're looking at the non-metastatic patient and we're watching their PSA doubling times, because all of the new drugs were approved based on a 10-month PSA doubling time or less. Because we know when we look at the research that this is when things really start to progress with the patients. If they have a 2-year doubling time, it's probably a pretty slow cancer, but when it gets to 10 months or less, that's when we need to intervene. And by intervening at this time, we've increased their metastasis-free survival, which is huge with prostate cancer, because we know when they become metastatic, that does decrease their length of life at that point in time. We are increasing the use of these agents. It is a small window, so we have to be we have to watch very closely on the men's doubling time, because they can go from being a year doubling time down to 10 months very quickly, or even a 2-year doubling time, and all of a sudden they start speeding up. And there's a small window between being non-metastatic and then all of a sudden having a metastatic lesion. The mode of action for apalutamide, enzalutamide, and darolutamide, they are all pretty similar. They're all androgen receptor inhibitors. They all block the DNA androgen receptor. They all block it going into the nucleus of the cell. The one difference is darolutamide does have a little bit less blood-brain barrier penetration, so we think that may have some help with some side effects. Darolutamide is a progesterone antagonist in vitro. We're not sure how that's going to relate to real life, but that's the mode of action of all 3 of them at this point in time. They all have a little bit different warnings and contraindications. So enzalutamide, for example, has been around the longest, so we have a lot more experience with it, and we have post-marketing side effects that we have noted too. So enzalutamide has a risk of seizure. It's a small risk, about 2%, but those patients that have a history of any traumatic brain injury, TIAs, CVAs, Alzheimer's, any loss of consciousness within the last 6 months, any medications that may increase their seizure risk should not be put on enzalutamide. Apalutamide also has a small seizure risk, and so the same contraindications go for that. Darolutamide, because of the less blood-brain barrier penetration, at this point in time, there is no contraindications with seizures. The other risk that we have with both apalutamide and enzalutamide is ischemic heart disease. We have seen an increase in possibility of that, so if a man has pre-diagnosed MI, unstable angina, heart problems, you have to watch them much closer, and you may want to choose a different mechanism. Now, darolutamide has more heart failure than the other 2, so there's a little bit of a difference there. With enzalutamide, they have had some marketing reports of posterior reversible encephalopathy, or it's called PRES syndrome. And this is where they can get seizures, headaches, they can get lethargic, and they can actually have blindness come on. This is something that we've seen with other drugs. It's not just enzalutamide alone, but there has been some reports of that, so we do think about that also. With apalutamide and enzalutamide, they both also had increased risk of falls, about 12%, falls and fractures both. Again, we think this is because the drug gets into the brain a little bit easier. Darolutamide did not have the increased risk of falls and fractures in the studies that were done. So those are some of the things that we look at when we're looking at the different drugs and how we determine which one we're going to use. In regards for the drug interactions, they all are CYP3A4 pathways, but they also have some other pathways in there. So it's very complex between the different 3 drugs, what drugs you have to worry about interactions with. So we do rely on our pharmacologist and also our drug interaction checker, because it's hard to know all the drugs that they could interact with.